Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H serves children in foster care or Division of Juvenile Justice and Opportunities for Youth Community Services Supervision who've been diagnosed with serious emotional disturbance, developmental disabilities, and/or medical fragility. Once enrolled in B2H services, children may continue to receive services even after discharge from foster care through age 21, as long as they are otherwise eligible. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. In this chapter, Chapter 5, we'll be reviewing the referral process, and here to help us understand more about B2H and how it works is Kimberly Jefferson. Ms. Jefferson is currently employed with the Office of Children and Family Services as a program specialist in the Bureau of Waiver Management. She has more than 20 years' experience working in the social services field. Kim, thanks so much for joining us today.
Thank you.
Once the child has been identified as potentially eligible for B2H, it's important to begin the referral process by convening a meeting with the child, medical consenter, and caregivers. The meeting is convened by the local Department of Social Services, ACS in New York City, or DJ Joy. Now, Kim, what happens at this meeting?
Well, first of all, the family is presented with an overview of the B2H program. And then the caseworker will meet with the medical consenter and tell them the options with the healthcare integration agencies that are available to them. The medical consenter then can, at that time, can decide which healthcare integration agency they feel would best suit the child's needs. The medical consenter will also be presented with 2 different forms. One is the referral form, and on the referral form it has the information about the healthcare integration agency as well as the contact person, and then the authorization for release of information form, which allows the healthcare integration agency to obtain information in order for them to complete their enrollment packet.
The local district will gather documentation that supports the child's diagnosis. This information will be included in the referral packet. Kim, what happens once all the information has been gathered?
After all the information has been gathered, actually it's called a complete referral packet. That packet is sent to the chosen HCIA, Healthcare Integration Agency. Then the local district, or ACS, will assign that HCIA a rolling connections that will allow the HCIA to gather information that's in connection as well as input information themselves.
And what are the HCIA's responsibilities once they've received this referral packet?
Once the HCIA receive the referral packet, they have 60 days in order to review the packet, to contact the candidates, to complete what they call a preliminary IHP individualized health plan, which talks about the strengths and needs of the child and family. They also need to complete the appropriate level of care form, and then they take all of that information and they send that back to the local district for approval.
So what happens once the local district receives that application for enrollment packet?
Once they receive the application for enrollment packet, they have one of 3 things they can do. One is that they will approve the packet, the child is eligible, and they will sign what's called a Notice of Decision Authorization form. If the child is approved and there are no slots available, then they will put them on what they call a wait list, and that notification will be sent to the Healthcare Integration Agency as well as the medical consenter. But if for whatever reason the child is not eligible, they will then send the Notice of a Decision Denial of Enrollment form. But once the application has been approved, there's a slot available, then services can begin.
Okay, great. Kim, thanks so much for being with us today. That brings us to the end of Chapter 5, the referral process. In Chapter 6, we'll review the roles and responsibilities of ACS, the local departments of social services, and DJ Joy.